let's understand who are at risk for developing this COVID infection. This is going to be a series of publications, like maybe in 3 or 4 videos I'll be giving under one headings. And this my first discussion is who are at risk for COVID infection. You see, we need to understand many a time this is you've heard very common, like one answer is people who are having immunocompromised, 2 elderly people, 3 diabetic people. So they have some classification. They say who are at risk for developing this COVID infection. So we need to understand almost the entire generation and the entire humankind is susceptible, succumb to this, getting this infection. So it is not like we are to be differentiate ourselves. It is like a common flu. Am I right? Yeah. COVID is not something very unusual in this generation or in this decade. We have come across swine flu, bird flu, so many flu we have witnessed in this last few years, last few decades. But why COVID has taken us as so many vulnerable to deaths and seriousness, hospitalizations, deteriorating health, so much of pressure and declining this economic situations, restrictions, lockdowns, isolations. Why not before it has happened? So vulnerability. This is what I will be making you understand in the next coming speeches. My concern is who are at risk for COVID. Is the entire human population is at risk, right from childhood to geriatrics. Everybody is getting this risk. Otherwise, why we have been told to maintain social distancing? Why we have been asked to wear the mask? Why we have been asked to avoid overcrowding? Even if you are healthy, this is very simple. It is like a common flu. It spreads very easily. Even if you are a healthy individual, you will get this COVID. Even you are vaccinated, you are getting this COVID. Even you have developed COVID, recovered from COVID, you are getting COVID for the subsequent time, second attempt. Even you are, forget this, you are not a diabetic, you are not immunocompromised, you are not something like on steroids or on medications, or you are not obese or anything. Any individual who are going to have an interaction with a COVID individual are likely to develop COVID if you don't follow the necessary precautions. So let's understand this and let's try to see in the subsequent topics how to overcome or prevent COVID. So I will catch up you in the next topic and will give you even further discussions which will make you become confident and rest assured and need not worry about COVID. Good day.
குழந்தையின்மை, சர்க்கரை நோய், இரத்த அழுத்தம், உடல் பருமன், தோல் மூட்டு வியாதி, புற்றுநோய், இப்படி எந்த நோயா இருந்தாலும் சர்வதேச ஆராய்ச்சியில் அங்கீகரிக்கப்பட்ட ஃபங்க்ஷனல் மெடிசின் வழியில் எளிமையா சிகிச்சை வழங்கி குணப்படுத்தவும் முடியும், நோய் வராம தடுக்கவும் முடியும்.
ஆரோக்கியம் நல்வாழ்வுக்கு ALM ஆயுஷுக்கு வாருங்கள்.
நோயற்ற வாழ்வே குறைவற்ற செல்வம். அதுக்கு ALM ஆயுஷ் வாருங்கள்.